Hello everybody, and welcome to the background information on our poster called Whole Genome Sequencing Improves Sarcoma Diagnosis and Patient Care. My name is Luuk Schipper, and I'd like to thank you for your time and interest on our poster. Sarcomas are a heterogeneous collection of various tumor types, and with more than 70 histological subtypes, the pathological classifications of these tumors can sometimes be challenging. Secondly, sarcoma patients have a limited number of therapy options and, as a consequence, a rather poor prognosis. The detection of actionable variants can increase the number of therapeutic opportunities for these patients. And finally, a paired germline and tumor DNA analysis can identify potential underlying pathogenic germline variants. Taken together, we hypothesize that a complete genomic characterization using whole genome sequencing can improve the care for sarcoma patients in these various ways. To test this hypothesis, we performed a prospective whole genome sequencing analysis in 83 patients with a sarcoma or a suspected sarcoma as part of a larger study on the feasibility and clinical validity of whole genome sequencing as a diagnostic test. In these 83 patients, we observed that the whole genome sequencing analysis led to a diagnostic revision in 12 patients. The diagnostic revisions can be seen in Table 1, showing the suspected diagnosis before the whole genome sequencing analysis, the diagnostic revision, and the genetic events on which the diagnostic revision was based. Finally, in Table 1, we can see the number of pathological assessments these patients underwent before the whole genome sequencing analysis. The high number of these pathological assessments per patient show the diagnostic complexity of these patients. In 8 out of the 12 patients with a diagnostic revision, we saw that the diagnostic revision led to a change of the therapy plan. In Figure 1a, we see 4 patients whose therapy decisions changed after the diagnostic revision. The therapy choice after the whole genome sequencing analysis is depicted as the above line, the therapy that the patients actually received. And at the bottom in red, you can observe the therapy choice that was made before the diagnostic revision and the whole genome sequencing analysis. In the lower panel, you can see 3 patients who already received a therapy choice that would not have been preferred if the whole genome sequencing analysis was performed earlier. Secondly, in 36 out of the 83 patients, we observed an actionable event. As you can see in the pie chart, the majority of these actionable events make treatment with a CDK4/6 inhibitor possible. In 8 patients, multiple therapeutic opportunities based on the whole genome sequencing were identified, as you can see in the bar plot on the right side of this slide. Finally, in these patients, there were 8 pathogenic germline variants present. The germline diagnostics that were required to detect these pathogenic germline variants were often not performed in the regular workflow, and only 2 of the 8 germline variants were previously detected. In 1 patient, there was a double germline mutation present in both CHEK2 and BRCA1. In conclusion, a prospective use of whole genome sequencing analysis in 83 patients with a sarcoma or a suspected sarcoma led to a diagnostic revision in 12 patients, the identification of actionable events and therapeutic opportunities in 36 patients, and we observed 8 pathogenic germline variants in these patients. As a conclusion, we advocate the use of whole genome sequencing in sarcoma patients in this setting. I'd like to thank you for your time again and your interest. If there are any questions, you can always reach me on this email address that's shown here and on the poster. Thank you very much.